Thanks for joining us on Not Boring CEs, where we don't think you should be bored to death while getting your continuing ed. Keep listening here, then hop over to notboringces.com to get all your online CE credits. All right, y'all, let's get to learning. Aislinn Burke, LMFT, CEDS-S, was born and raised in Canada and gifted a Gaelic name pronounced Aislinn, which she gets to explain to each new client she meets. She graduated with a Master of Science in Marriage and Family Therapy in 2004 and has been working in the field ever since. After working in treatment centers for youth with a variety of mental health issues, she shifted focus into the eating disorder world in 2013, working in an inpatient setting. She's also a certified eating disorder specialist and supervisor. Working in an inpatient setting started her passion for helping people move through the very complex issues that come with eating disorders. She opened her own practice in 2019, and one of her favorite things to do is mentoring and supervising other clinicians. She's passionate about helping clients, fellow therapists, even friends and family unpack our culture's anti-fat bias and pervasive diet culture. Welcome to Not Boring CEs. I'm here with Aislinn Burke, and we are talking about eating disorder patterns. We're talking about anti-fat bias. We're talking about all sorts of things, myths and facts with eating disorders. I'm excited to have this conversation with Aislinn because I feel like there's a lot that when you don't specialize in eating disorders, you don't know about eating disorders. And there are people in your caseload with disordered eating at the very least, and eating disorders maybe so. So yeah, I'm excited to talk to you about this today.
Good. I'm excited to talk to you as well. It's nice to also talk to another expert with each disorder background. So it should be good. Yeah.
Yeah. Well, can we start with kind of some of the underpinnings of disordered eating and eating disorders, which I see as anti-fat bias? And just talk about like what that is, where it shows up in our culture and our sessions, all of that.
Yeah, I mean, that was actually a lot of my own unlearning working with eating disorders. I think when I first started working with eating disorders, to be honest, I actually didn't know a lot about anti-fat bias. And in fact, I think even some eating disorder clinicians reinforce anti-fat bias. So my unlearning has really happened over the last couple of years, which I'm really grateful for. There's people out in the community doing really good work, like Aubrey Gordon is probably one of my favorites. But anti-fat bias is really this cultural sort of a norm about implicit and explicit bias against fat individuals, even, putting it as a moral failing or somehow a problem of that individual, when really that it's a cultural problem. And I think we see it everywhere, right? That it's still deemed kind of normal or okay to make fat jokes, or we see it in our culture, in movies, in TV shows. I'm now so acutely aware of how often that is just steeped in our society, and it just kind of like gives me the icks now. But to assume it doesn't show up in our clinic, I think is really naive, right? Because I think even as clinicians, we have to explore what is my own biases against fat individuals, what stereotypes do I hold? I think even using the word fat, I think for a long time was uncomfortable for me until I started unpacking and learning this idea that fat is actually just a neutral term to describe how somebody looks. And yet it's so loaded with stereotypes, right? That I think even for a clinician, it's like, how comfortable are you using the word fat? Do you talk to your clients about how do they talk about their own body, right? Even my own clients that are fat, we talk about what language are you comfortable with me using? Because even themselves feel like fat is negative and pejorative. And so unpacking that, I think, is so critical and important.
Absolutely. And every like eating disorder CE we've done so far, there's like a conversation around the word fat, because I don't know that people outside the eating disorder field know that this is a movement.
Yeah. Right. That it's like actually that fat individuals themselves are saying, we want you to neutralize this term. We don't want this to be negative. Right. And I still think even in the eating disorder community, there's a part of that. I remember being trained to reassure my clients that we weren't going to get them fat.
Yes.
And now I'm like,
it makes me feel so much better to hear somebody else admit that, because I hate that. Like we would literally say like, don't worry, we won't let you get fat.
Yeah. And I cringe. Like I think about my early clients and I just want to go back and apologize, right? Like, I'm sorry, I didn't know any better. Like I can still feel that shame when I go back to those sessions. And so I think even in our eating disorder community, there's still a handful of clinicians that haven't done the work or understand that, or you know, that even in treatment centers, they're still doing body tracing or things like that
Hmm.
that are just like so anti-fat bias stuff.
Yeah,
Yeah.
absolutely.
Yeah. And so I think even about the things that I even started to have to think about, like, does my office accommodate for all individuals and their bodies? Like things that I had not being, you know, having the privilege of being in a straight size, things I hadn't thought about. And so that
Hmm.
was really something when I went into private practice, I had to look at like, does my couch accommodate fat bodies? Do our seats in the lobby accommodate that? You know, as clinicians, are we paying attention to that of accommodations that actually are comfortable and fit for all bodies? You know,
Hmm.
those are some ways that I think even implicit bias comes into our offices.
Absolutely. Yeah.
Mhm.
And if it's in our offices, it's also in our clinical work. Like if it's not something you've thought through
Yeah.
yet,
Hmm.
in just the way that you decorate, it's something you haven't thought through yet in a way that is impacting your clients clinically.
Yeah, right. You know, I thought that was like the one thing in Aubrey Gordon's work where she talked about everybody should do the Harvard implicit bias
Hmm.
um, thing with weight. And I often wonder how many times as clinicians are we actually doing some of those Harvard tests to really see what are my implicit biases that come up,
Hmm.
right? And even though I've done deep dives on that, when I did the implicit bias, I was like, yeah, I still have biases, and we can't. I mean, that's something as clinicians we have to be aware of. Like we all have implicit bias, right?
Right.
Especially because we live in the culture that we do. And
Hmm.
so, even if you're not working with eating disorders, have you done that work? Have you explored your own stereotypes around all bodies? Do
Hmm.
you have judgments around certain body types or beliefs around that? Like, do you
Hmm.
see that as a laziness or moral failing, right?
Hmm.
Or do you actually understand the research behind all body sizes and how the BMI is kind of bullshit, right?
Uh-huh. Yeah, not kind of, but
Yeah,
ultimately
not kind
quite.
of.
Yeah.
Yeah, right. Which again, like when you do the work, it's so obvious, but I can't tell you how many times my clients have been like, what? Like the BMI was developed by like a statistician, you know, that the history doesn't show any support that it has any indicators for health, right?
Hmm.
And yet we do that all the time. I
Yeah.
can't go to any doctor's appointment without asking to be weighed,
Hmm.
you
Yeah.
know. It's just so entrenched in our system that people don't even understand that it's like unnecessary and unhelpful.
Right. And I think about how we're all swimming in this soup together, right?
Yeah.
Like the
Hmm.
ask is not get perfectly okay with your body and all bodies and have like this super beautiful relationship with fatness,
Yeah.
with thinness, with fitness, with all of it. Like that's not the ask. The
Hmm.
ask is to examine your own biases, the places you get stuck personally, the places like the things you think when certain people walk by. And that
Yeah.
can be the fat shaming that might go on in your head. It might be that, but it also might be putting people who look a particular way on a pedestal.
Yeah. Right.
And
Yes, like how we elevate thinness, right? I think that's kind of even part of diet culture, that
mhm,
we elevate thin bodies over other bodies, right? And
mhm,
we assume something about them, that they must be better than us or more capable than us, when really a lot of times it's either genetics or probably disordered behavior.
mhm,
Right.
absolutely.
Yeah.
Yeah.
Hmm. Yeah.
And I think about how the genetics piece is something like the bad fitness industry really
Yes.
wants to pretend isn't so.
Hmm.
Um, that like some of our bodies are just where our bodies want to be, and
Hmm.
the idea of like set point and like you have to work extraordinarily hard to lose weight if your body is where it is healthiest.
Right. Yeah.
Um, and then what, like, if you're moving away from where your body is healthiest, like, what are you doing? Like, if you're
Yeah.
actively saying, I would rather be less healthy and thinner, like,
Hmm.
it's a good indication to look at why and
Hmm.
just examine your motivations and your worth around that, like your self-worth
Hmm.
stories around size.
Yeah. And I mean, because that's what we're inundated with, right? I mean, wellness culture, diet culture will tell you if you just do XYZ, you can look like me, right?
Hmm.
When that's just not the reality for most people.
Right.
You know, and again, that assumption that those kind of bodies must be healthier, when again, the science, the data doesn't support that, right? When I think it was Catherine Flegel, she was a researcher for the CDC, when they really did study mortality rates of body size, right? There's only a
Mm-hmm.
very modest increase for
Mm-hmm.
mortality in those in the BMI of, I don't like to use this word, but obese range, right?
Mm-hmm.
That it doesn't actually support this idea of like war on obesity, that they're so unhealthy, and that actually underweight individuals had a higher rate of mortality.
Mm-hmm.
And again, that's sort of the thing that our culture is like telling us to chase, when
Right.
actually they're usually more unhealthy than people that just allow their body to stay where their body, like you mentioned, set point. It's sort of where our body naturally resides when we're eating normally, right? Moving our body, that's actually when we can be the healthiest,
Mm-hmm.
But I think that also brings up this even moral idea about healthism, right? That like, do we
Right.
even owe anybody our health status?
Right.
That
Yeah.
like that even if you quote have like unhealthy markers, that doesn't mean you're actually any less of a person either.
Right. Yeah, it's interesting because I'll hear the argument or not hear it, but I'll often see it in the comments in different posts, which I try not to read the comments, but sometimes I get sucked in. I know better. It's always
I
when I'm
know.
raring for a fight that I do it.
I know, you're
Um,
like, I just feeling feisty.
yeah, yeah. But I'll see like, well, you're making our health premiums go up. No, y'all. The people who are making the health premiums go up are the CEOs of the
Mm-hmm.
health insurance companies. Like they're the ones bringing home record
Yes.
record incomes and bonuses.
Mm-hmm.
And the rest of us are all struggling with like increasing premiums, increasing deductibles.
Mm-hmm.
No, none of us are doing that to us.
Yeah, I mean, like that people don't take a step back and say this is a for-profit industry. I
Right.
grew up in Canada with like nationalized healthcare, and so
Mm-hmm.
coming to the US, I was like, it was just insane to me. And the assumption again that it's these fat individuals that are causing our premiums to go up when it's actually just capitalism and corporate greed, right?
Right.
They are not dying at younger ages,
Mm-hmm.
that, and a lot of them have really good health markers, right? A lot of fat individuals will have nothing actually wrong with them when they go and
Mm-hmm.
get their labs done,
Yeah.
right? Strong hearts, strong bodies. And yet we've developed this idea or belief that somehow they are the problem, right? It's
Mm-hmm.
like we're othering them, which we do in a lot of other forms of discrimination, right? When it comes to race, sexuality, yet with weight and body size, people still aren't like actually acknowledging that this is a form of discrimination,
Right.
right? And I think still, what is it? I think 48 states still allow discrimination against fat bodies, which is insane to me.
Can we
That,
talk some about like what that ends up looking like?
yeah,
What the discrimination looks like and the
people can
fallout.
get, people can get fired from their jobs for being fat. They can lose homes or different, not be able to rent. Like they're actively allowed to discriminate against them. I
Mm-hmm.
think even too, statistically speaking, that fat individuals get paid less on average, several $1,000s a year. And then when you add fat women, it's even more, right? Because we already know
Mm-hmm.
disparity against men and women. So paid less likely to be hired or offer employment, right?
Mm-hmm.
That this is a very real thing. And if you talk to any individual, they will also talk about even just the overt discrimination, being yelled at on the street, right?
Mm-hmm.
Um, I had a client, even she enjoyed working out and at the gym, unsolicited remarks from others, telling her like, good job, way to go, keep it up. And, and she's like, I don't even, this gym is no longer even safe for me. She's
Right.
not going to the gym for accolades or even to try to lose weight. And yet people think that they have the right to go and say to her, hey, good job.
Right. It's so, ugh, like
Yes.
it's so demeaning. It's
Yes.
and they're well-meaning people, I'm sure, like, but I think it's people who haven't examined their own fat bias that
Yeah,
they
to say
think
like,
obviously, yeah.
would I go up to a straight size individual and be like, way to go, like keep it up, right? That that is that sort of implicit bias again, assuming that the person is at the gym to do something to change their body
Right. Right.
versus I just like to work out.
Hmm.
Because again, the stereotypes that fat individuals must not like to work out and they must eat certain kinds of food or in
Hmm.
certain amounts, when that's just not true.
Right. It's interesting how like the science is very clear,
Yeah.
but it's not science that gets headlines. It's
Mm-mm.
not science that everybody knows. I mean, people will like send around a thing about how drinking a glass of wine at night is good for your heart, which is also bullshit. So they'll like send this all around because it supports what they want to do, basically. But
Yeah.
this kind of thing, like people jump all over you if you post
Hmm.
it.
Yeah, yeah.
Um, and so
Well, again,
people
because
don't post it because they don't want to have to fight people all day.
no, and just, I mean, and you see that, like you were talking about on social media, you see how much the trolls come out. You
Hmm.
know, for some of my favorite fat content creators, the amount of hate and like just disgusting stuff spewed at them for
Oh
saying
yeah.
or doing things that even straight content creators will put out, right? Even if it's about eating certain kinds of foods or if they show their body, right? That it, I just often really appreciate the work they do because I can't imagine the toll that that takes to see
Yeah.
that stuff over and over again. And it could
Yeah.
be the exact same kind of post as somebody that's straight sized or what our culture sort of deems as, you know,
Hmm.
beautiful. And everybody is like all over it, like, way to go. Like, you're awesome. Keep eating
Right.
that pizza. Right.
Hmm. Versus like,
Yeah.
you're disgusting, you should kill yourself, which is the
Yeah. And
common like vibe.
yeah. Yeah. And that you're glorifying obesity and that you're, you know, all of that kind of stuff because there's big money in this idea of like quote war on obesity. You know, that Catherine Flagel, who I mentioned earlier, she got so much hate over just reporting the data,
Yeah.
you know. And so even the people that are trying to do the work to dismantle this get so much hate,
Hmm.
you know. So I don't blame people from bowing out. And at the same time, like we're not going to shift society unless people are willing to speak up.
Right. And it's exhausting. I'm thinking about like
Hmm.
as an eating disorder therapist, particularly when I was doing a lot more clinical work,
Yeah.
to feel like my social media life slash personal life was fighting this fight. My
Hmm.
clinical life was fighting this fight. And
Hmm.
I'm a like thin, privileged, cishet white woman. Like
Yeah.
I've got it pretty easy.
Yeah. Got a lot of
Um,
privilege. Yeah. Even
yeah.
having that conversation with you today, it's so important for me to talk about it, but I also am like, should I be the person talking about it? Right. Because I haven't had that lived experience. I think some of the things that have helped me say like it's important for me to speak up is that some of these fat therapists, eating disorder clinicians are saying we also need allies, right, that are
Mhm.
willing to support this. But yeah, the amounts of privilege I have, which I think is something, even when we talk about implicit bias, when I am working with my vet clients, I talk to them about like, okay, I know I have privilege, right? And I
Mhm.
want you to know that I believe your stories and I want you to talk to me if that's coming out, right? If my privilege is interfering with our work. Because I think that's another aspect of just being able to name our privilege is important when we're working
Mhm.
with clients in larger bodies.
Yeah.
And
Yeah.
like
And
from
I,
the reverse, oh, go ahead.
no,
I
you go ahead. From the reverse.
was going to say in reverse, I have an employee that is a fat individual, and then she's had then the reverse, like that some of her eating disorder like clients will then not want to work with her, right?
Mhm.
Because again, their own biases against body size. And so we've seen that in reverse that she's a great clinician. She does great work with eating disorders. Um, and even eating disorder clients at times have a hard time with that.
Yeah. Yeah. Probably especially because they already have so much harsh self-judgment and fear around food and
Hmm.
body.
Yeah, right.
Yeah.
And their own fear around fatness, right? Yeah.
Yeah.
Hmm.
So I think about how like we're all swimming in the soup. We're all I would like to think all therapists are doing the best they know how.
Hmm.
Um, and whether you're actively working in anti-fat bias or you're at least educating yourself, or this is the first time you've ever even heard that term,
Hmm.
um, there are ways that we can kind of protect our clients more in session.
Hmm.
Like I'm thinking about keeping our own diet culture garbage that might be in our own heads that like
Yeah.
I mean, like it
Yeah.
happens to all of us because we all live in
Hmm.
this culture. It just hasn't been extracted yet. But how to not, at least not reinforce the diet culture messages that our clients are getting day in and day out. Can we talk some
Yeah.
about what that looks like?
I think it's that the aspect of when clients will come in and say, I'm uncomfortable with my body and I want to lose weight.
Hmm.
As a clinician, do we reinforce that?
Hmm.
Right? Are we then saying, great, let's go over your diet and how can you stay on top of that? Right? There's a book that I actually really love around self-compassion. And there was a thing in the book that said something about like giving yourself compassion when you fall off your diet. Right? I was like,
Oh,
ugh, you know, but again, because that's so normalized, we think that's a normal behavior. And so I think clinicians need to be careful that if a client is coming in saying they want to diet or they're wanting to lose weight, are they like reinforcing that and supporting that goal?
Mhm.
Or are they actually talking to them about the potential risks or harms of dieting and what that can do to our body? Which again, I realize that most clinicians that aren't eating disorder clinicians don't understand what actually is happening to the body when they diet, right?
Mhm.
But instead, I would really hope that clinicians could start to look at sort of more the health at every size principle, like how
Mhm.
can we be um, feel better in our body and our mind that doesn't have anything to do with weight, right?
Yeah, absolutely. And I would love to get into some of like what does happen when we diet to help clarify, because I think this idea of like calories in, calories out is all there is.
Yeah,
And it's so much more complex than that. Like I myself, everyone in the world would love for things in life to be that black and white.
yeah,
But like very little in our life is that black and white, and certainly not our bodies.
yeah.
It's so intricate. I will say
Mm-hmm.
something I've said in pretty much, I think every one of the conversations I've had around eating disorders or disordered eating for CEs. And that's that if you are recommending a diet to a client, you were way outside your scope.
Mm-hmm.
And you could potentially and probably are doing harm, which is a
Yes.
strong statement, but having like any eating disorder therapist will tell you, we get so many clients that come to see us after seeing non-eating disorder client or non-eating disorder therapists where they talked about their diet. They were encouraged to diet, especially people in larger bodies. Like if your
Mm-hmm.
client is fat, they have they have tried all the diets. There is no diet
Mm-hmm.
that's going to magically make them where they want to be. I shouldn't say they have tried, but if they're struggling with their weight and they say they've had a lifelong issue with their weight, they have probably been encouraged to try every kind of diet, and the diets don't work. It's the diets, it's
Yeah.
not the client. So,
Right. Isn't that the most insane thing? Right.
yeah.
Sometimes I just feel like that this again, speaking of research, there is no research to support that sustained weight loss works, right? That
Mhm.
96% of people will gain all the weight back and then some, because biologically, when we are starving our body, which a diet is, right? Our body is undergoing physiological changes that is actually increasing our drive to eat. You
Mhm.
know, the body doesn't like to be starved. I often say to my clients, like, your body doesn't know that you're doing this intentionally, right? It's
Right.
almost as if your body thinks like, gosh, we must be in a famine, so what do we do, right? It slows down metabolic functioning. All of like your hormonal functioning kind of goes wacky. Metabolism slows down, and it will start using your body's resources to
Mhm.
meet its nutritional needs, which I remind my clients all the time. It's not like your body goes like, I'm going to zap that fat there. It's going to take energy from your muscle.
Mhm.
and and I always say, and guess what else is a muscle? Your heart, right? That's why we
Yeah.
see so many clients that have dieted or restricting having heart issues, cardiac issues. And
Mhm.
so it becomes this then very intense drive in your brain to eat because your body is trying to keep you alive, which, you know, the more work I've done in eating disorders, I can't believe actually all the things our body does to keep us alive and keep going.
Yeah.
Um, but that's why we become more obsessed with food, and we want, you know, your brain's just trying to get you to eat as much as it can. And so hence why people feel like, oh, I have no willpower, right? I cut out these foods and then I just go crazy on food at night or
Mhm.
on the weekends. But that's because that's what your body is doing to try to protect you and get you back to your baseline. Your body wants to bring you back up to what your sort of set point resting is, which is why dieting is actually so harmful, and why we see with our clients like a variety of issues, right? They could have metabolic issues, delayed emptying of their food in their stomach, heart issues. Um, Over time, people can actually lose gray matter in their brain if they continue to restrict, you know.
Mhm.
And so when clinicians are encouraging diets, you know, that's actually going to worsen their mental health. You know, I always say, like, fun fact, you're actually going to probably feel more anxious and more depressed. You might lose the weight, which sometimes people initially have like a euphoric, like, oh, I feel so good. And they're usually getting compliments by people around them. But at the end of the day, they're usually much more depressed, much more anxious, much more obsessive. You know, like, as clinicians, we're supposed to be helping mental health, and dieting is the exact
Yes.
opposite.
Yeah, which if you've ever had a conversation with someone on a diet when you're not interested in a diet, you will like it's dreadfully boring to hear
Yeah.
someone talk about their diet when
Mm-hmm.
like but it's all they can think about because that's what their body and brain are doing together to help keep them safe.
Yeah, they're like
So,
starving, right?
mhm.
Which is why you think about food. And all the time when I tell my clients this actually has nothing to do with willpower, you just kind of watch the shame like just
Yes.
disappear out of them. They're like, what? This is not a me problem. I'm like, no, this is a biology problem,
Right.
and a cultural problem. And
Yeah.
I mean, that doesn't mean that suddenly they're satisfied with their body, but it gives them that the relief that this was never actually about me. Right.
Right. Because we're taught to shame ourselves because we
Yeah.
see other people being shamed for not being whatever size is deemed appropriate, which
Yes.
the shape constantly changes over
Mm-hmm.
over the decades. Like I think about growing up as a teenager in the 90s
Mm-hmm.
and how like what was attractive then and how different that was from what was attractive 5 years ago and what's attractive now. And like
Mm-hmm.
all of it's thin, don't get me
Yeah.
wrong, but the shape of
Mm-hmm.
it shifts. It is just trendy and it's just like people hurting themselves, hurting their mental health, hurting their hurting their physical health
Mm-hmm.
for because they're trying to be good enough.
Yeah. Right.
Which we see all over the place clinically in non-eating
Mm-hmm.
disorder contexts too. Like, aren't most of our clients on some level just trying to be good enough
Mm-hmm.
in the different ways in which that manifests for them? And don't we
Yeah.
all, on some level, struggle with that sometimes ourselves? And this is a
Yeah.
way that culture is like, yes, you should be good enough this way. This is the right way.
Right, because we're fed that lie that you can do that, right?
Hmm.
We're not ever told this lie that we can make our feet smaller, right? So we just
Right.
have to like radically accept that. If you don't like your feet size, it is what it is.
Hmm.
But we are fed the lie that we can actually somehow change our body, right? And
Yes.
I mean, I guess with plastic surgery and things like that, yes, we could change certain aspects of our body, but the size of our body is not actually something that we can change.
Hmm.
And and that's people will tell you that all the time, right? Anyone that's dieted or had an eating disorder, you'll yo-yo, but your body
Hmm.
keeps coming back up to your
Yep.
set point, right?
And often a little
Um,
higher. I mean, that's
yeah,
another,
usually, yeah.
yeah. Like if people were looking at the data, they would never
Hmm.
go on a diet ever.
Yeah, right.
Because like it's like how much weight do you want to gain in 2 years? Is basically what it
Yeah,
looks like.
yeah.
Um,
And not to mention, like, what an incredibly shaming process, right? You lose all the
yes.
weight, everybody gives you compliments, you start
Hmm.
gaining the weight, and then you think, oh, this is a me problem
Right.
versus, oh, this is what my body is doing to actually protect me and keep me safe and keep me alive, right? And that then you go back to like those feelings of despair again about your body. And I think that that is so pervasive in our culture, right? That we can somehow change it, but then if we can't maintain it, it's a moral failing, right?
Right.
And I get it. I mean, learning to be accepting of all of our flaws, whether that's internal or external, right? Like you were saying earlier, that's a hard thing.
Hmm.
And so as clinicians, it, we need to work with our clients more about what does acceptance look like, right?
Right.
What does recognizing that our worth or value doesn't come from our appearance, even though we will be getting lots of messages about that, right?
Hmm.
And holding space that for our fat clients like that, discrimination is like very real,
Hmm.
right? And so as clinicians that don't necessarily work with eating disorders, how can they support them in that? How can they help them to advocate for themselves, speak up for themselves, you know, push back on pressure from
Hmm.
doctors or other people in their lives to lose weight? Those are ways I think to not reinforce that diet culture.
Yeah. Yeah. And I think about like just as a parent thinking about it as like seeing how it shows up early on in kids' life, like how it gets shoved down their
Yeah.
throats so early. Like even when my kids were toddlers, people were like, "Oh, you're so pretty, you're so little, you're so cute," like these things. And
Mm-hmm.
just
Mm-hmm.
like, because I've been in this work for so long, I could very quickly be like, "She's hilarious. June, she's
Yeah.
hilarious." Oh, you mean Adair? She is the nicest person I've ever met in my life. She's like the
Yeah.
most sweet, generous kid. Like, let's refocus on things that actually matter.
Mm-hmm.
And I know
Yeah.
that, like, when you see a kid you don't know, the thing you see is how they look. And
Mm-hmm.
for some reason, you feel like you need to compliment the child. But I mean,
Mm-hmm.
like, you're
Right.
doing harm. You're just like
Yeah.
perpetuating this idea that them being cute and getting attention for being cute is important. And
Yeah.
it's really not.
Mm-hmm. No. I mean, and my 7-year-old, she's already started to ask about her body in
Hmm.
ways of like negative. And the
Hmm.
first time she asked me about the size of her stomach, I just like internally was like, oh my gosh, what am I doing wrong? Like this isn't even
Oh,
anything I believe or talk about, right? And
right.
that's when you realize how pervasive it is. That if a seven
Yes.
year old is already aware of her body and it's
Hmm.
not even anything in her home that we talk about,
Yeah.
how much is she hearing in the outside world, right? It was
Hmm.
like it broke my heart because
Yeah.
sometimes we think, well, because I do the work and we don't talk about bodies at home, I'm gonna have really like self-assured kids.
Yeah. I
And
wish.
I'm like, oh yeah, it's like, no, right? It just is. And they come home already even with worksheets about circle the healthy food, circle
Oh,
the unhealthy
yes.
food, right?
Yes. We had red light, yellow light, green light foods. And I was like,
Yeah.
who do I talk to?
Yeah, because we're not doing this, right?
Uh-huh.
Yeah. I know, like our school did like a no soda challenge for a month, and I'm like, yeah, no, we're not doing this. But
Yeah.
meanwhile, like my kids' friends came over and they wouldn't drink the soda, but they had no problem drinking three of our juice boxes, which again, I don't care if they have three juice boxes, but in my head, I
Right.
was like, this is when we start elevating soda as bad. The child doesn't actually learn that probably there was just as much sugar in both of those things, which, and
Right.
again, totally fine.
Hmm.
But we're creating issues with food that just don't need to be there.
Right. Right. Like I think about how much easier everyone's life would be if we all had like a culture of body neutrality.
Yeah.
Like
Hmm.
literally the hours people would get back into their day.
Right. Yeah, because we would probably feed ourselves like a variety of foods. We'd probably
Hmm.
feel comfortable moving our body in a variety of ways, right? That
Hmm.
if we don't mess with it, I think our body knows what to do.
100%.
Yeah.
I think that's the thing that is so, that's the thing, as if there's just one thing. That's one of the things
Yeah.
that is so mind-boggling to me is like if we just stay at the hell out of the way, our
Hmm.
bodies are where they're healthiest.
Yeah.
Like if our mind or our judgments stay out of the way, our cravings make sense and we
Hmm.
satisfy them. The amount of food is just naturally regulated by our hunger and satiety.
Yeah.
Um, and there's still plenty of space in there for pleasure with food.
Hmm.
Whereas the way that we're doing it now, that is so often highly controlled, just does the opposite of what all that control is aiming for.
Hmm. Yeah. You lose trust in self, right?
Hmm.
And that's one way that I weave it in with my clients is that so much of the work is like, how do you learn to trust yourself again? And the same goes when it comes to movement and with food, right?
Hmm.
And so as clinicians, the way that you keep diet culture out is really getting your clients to go back to trusting themselves, right? Not
Yeah.
encouraging them to restrict foods or keep certain foods out of the home, right? Because they're worried about overdoing it.
Hmm.
But I think if that stuff starts coming in, that's when probably this client might need somebody more specialized in it. But I do think for clinicians themselves to unpack like how much am I engaged in diet culture
Hmm.
and do my own biases around food and body come into play when my clients are talking about their food and body, right?
Right.
Mm-hmm.
Right. I think about how, despite being a therapist for 20 years now, I still sometimes forget to check in with myself to see how I'm feeling. Like,
Mm-hmm.
how actually am I? Like days can go by and I'm like, I have not, like, I've just been a robot. I've been going.
Mm-hmm.
And I don't know how I'm feeling and I need to stop and check in. And that's the same thing for so many of us with checking in with hunger and satiety. Like, it is time to eat, so I'm eating
Mm-hmm.
versus, am I hungry? What am I hungry for? Like,
Mm-hmm.
what sounds good? And we've been diet, like any experience with diet just takes us farther and farther away from being able to like hear because our body tells
Mm-hmm.
us. We just have to be
Yeah.
willing to listen. Um, and if we just if we just listen, it'll tell us. Um,
Yeah. Yeah. I use that example all the time. Like when you're traveling, I get to a certain point where I'm like, God, I need like the biggest salad I can have, right?
mhm,
Because my body is telling me you need different nutrients.
yeah,
And that's what diet culture really robs from us is that inner knowing, right? That
mhm,
that we do have cues and it won't lead us to always just want the ice cream, right?
right,
And when we want the ice cream, great, like we can have it. We don't have to be afraid of it. We don't have to like eat so much of it that we feel sick. But you don't get there if you're still restricting, whether it's like
right,
physically restricting or even the moral restriction, right? So some of my clients might still be eating a variety of foods, but when they're eating certain foods, they're still having a lot of shame around that, like, I'm so bad, I shouldn't eat this, right?
mhm,
What's this going to do to my body? And again, going back to the science, your body doesn't know if you're eating ice cream or apples, right? It just is
Right.
like, what am I going to get from the ice cream that I need? Great. And then I'm going to get rid of the rest. And the same with an
Hmm.
apple, that I say that all the time. Like your body doesn't have morality around food.
Yeah.
It doesn't
Yeah.
like, okay, now you're going to gain 5 pounds because you had ice cream. Like it doesn't work that way.
Right.
And
Absolutely.
yet that's what diet culture tells you, right? Like this is the perfect way to eat if you want optimal health. And I always want to say, like, well, show me the science, right? Or
Right.
give me the 10-year data on that diet,
Yes.
and then we'll talk.
Yeah. Yeah. I So we're talking about intuitive eating, where we're
Hmm.
talking around intuitive eating. Maybe
Yes.
let's talk about it, so
Yeah.
that people who aren't familiar with it have just more info. Um,
Yeah. I think with intuitive eating, how I really just say that is, to me, is intuitive eating is just eating, right? If we didn't mess with our biological cues, it would probably be how we all naturally eat, right? Eating to fullness, noticing when you're hungry and eating when you're hungry, getting rid of the morality around food, good, bad, right? That if we think about babies, infants, they know when to alert us when they're hungry, and they also know when to stop,
mhm.
right? And over time, depending on how we have grown up around food, we start to lose those cues, whether we don't have full hunger or fullness cues, or whether we're afraid of certain foods or not, right? So, um, intuitive eating is a great framework. And I think, though, at the end of the day, it's just what I would call natural eating when we
Right?
don't F it up, right?
Yeah, yeah. Which most of
Yeah.
us have, right? Like
Yeah.
most people have
Mm-hmm.
been like, oh, well, I shouldn't have that because it's high calorie or whatever,
Mm-hmm.
or less nutrient dense, or I mean, most people say like it's junk food or it's unhealthy or
Yeah.
something like that, but like there's space for that.
Mm-hmm.
Like there are
Yeah.
times when you're going to crave French fries and there are times when you're going to crave kale.
Mm-hmm.
And like if you're listening, it all balances out. But if
Mm-hmm.
you're like, I cannot have French fries, it is so wrong. At some point, you're going to have French fries, but you're going to have far more of those French fries
Yeah.
than if it was just available all the time. Like
Yeah.
Halloween candy, like in our household,
Mm-hmm.
the Halloween candy is left out. And because it's
Mm-hmm.
left out, like honestly, after 2 months, most of it gets thrown out because it's not like
Mm-hmm.
this is my only time.
Right.
We
It's
almost
like not
always have,
forbidden.
yeah, we almost always have ice cream in the fridge. It can stay
Mm-hmm.
there for months sometimes. Sometimes it's gone in a couple weeks, but like it's all available.
Mm-hmm.
And
Yeah.
we all know, like, if I have a hankering for ice cream, I'm gonna have it. And that's all right. Like, there's no
Yeah.
morality in it. We don't have
Yeah.
to run to the store, and that's lovely. It's here.
Yeah.
So,
Right. It's that, and you've probably seen that even with kids that come into your home. I can usually tell the kids that come into my home that might have restrictions around food because
mhm,
they certainly like our pantry. They certainly like all the things that they can access.
yeah.
And I notice they gravitate and eat more of those kind of foods than my kids. Right.
Mhm.
Again, no morality around it. I don't think it's good or bad, but you
Right.
can see how that kind of restriction leads to that obsession around that food, or that
Mhm.
overindulgence in that food. I don't even know if
Yeah.
that's the right word to use, but like overdoing it, right?
Yeah.
And that's sort of the framework of intuitive eating. It's really getting rid of the good, bad, healthy, unhealthy, the morality around it, and sort of seeing all foods as equal
Yeah.
and all foods as valuable, right? Because when you talked about French fries, it made me think about, like, how do we know that, on days that we want French fries, maybe our body is actually needing more fats, right?
Hmm.
For whatever reason, because the body is complex, right? That we need to trust that sometimes there's those moments, just like there's days where I can tell, like, oh, if I eat fast food, I don't think it's going to settle well. I
Hmm.
don't know why I know that, I just do.
Yeah.
Right.
Yeah.
and and that's the place that we can get to with food when we really do allow all foods. And like I said, it's not just allowing ourselves to physically eat it. We have to mentally really let go of this good bad and really actually see as all foods being good for us, right? And that actually, I think the thing too, over the last probably 5 years as an eating disorder clinician, to also say it's okay to also have pleasure in food, right?
Yes.
um, it's okay to at times have food that is connected to emotion, right?
Hmm.
So my clients that sometimes feel guilt or shame about emotional eating, I'm like, there's no shame in having something on a day that emotionally you want that.
Hmm.
It's also trusting that I have a whole bunch of other skills too, that so that when I'm in high emotion, I don't always have to turn to food, but there's also no shame if I want to have food in that moment too, right? That
Absolutely.
pleasure is, I think about, like, if this is the only life we have to live, I don't want to die not having any pleasure in my
Right.
life. And so I want to have good food and I want to enjoy it,
Yeah.
regardless of its X amount of calories, which is just a unit of energy, anyways, right? It's
Hmm.
like we've moralized even that, right? We can't go anywhere without seeing calorie counts.
Hmm.
And
Yeah.
it's just so absurd, right?
Hmm. Yeah. I'll always remember a client told me like she'd just gone to visit her grandmother who was in her 80s and came back and was like, my grandmother wouldn't eat. I think it was like a croissant with brie and ham or something. Like it was something that
Mm,
she was like, oh, I couldn't possibly eat that. It's too fattening. And it for my client who had an eating disorder, it was so eye-opening. She's like, I don't want to be like in my 80s worried about calories. I don't,
yeah,
that's not the life I want for myself.
yeah. Right.
And
To sort of be so close to death and still worried about your weight instead
right.
of
And like
just enjoying life.
you're not trying to be a bathing suit model at 85. I mean, like more power to you, but like you're
Yeah.
you're beyond whatever it is you're trying to reach. Like it's not,
Hmm. Yeah.
there's just, yeah, like you're not going to be young again. You're not going to be
Hmm.
any of these things. And it's that striving that so many of our clients and so many of us in different ways
Hmm.
do. Like it's the striving away from yourself as you are,
Yeah.
um,
Hmm.
that causes so much strife and so much obsession and lack of
Yeah.
connection. Like that could have been a connection point between my client who was working on food challenges and her grandmother who basically rejected it.
Hmm.
Um,
Yeah. Right. How much even just culturally we have connection to thing like with food, right? And
mhm,
so often diet culture or eating disorders rob us of that, of
yeah.
not being able to have permission to eat something that you loved growing up, right? Or being able to bake with your kids, or if
Mhm,
you do bake, not being able to eat that. And I think that
yeah.
that is such a connecting part of our culture, right?
Mhm,
That is really robbed from us with this whole pervasive anti-fat bias and diet culture.
absolutely. And
Hmm.
and it honestly feels it ends up being anti-pleasure as well,
Yeah.
right? Like,
Yes. Yeah.
and I mean, I
Right.
think capitalism plays into that too, but I think if everybody listening right now took a moment to think about like the top pleasurable experiences they've had in the last week, it might be fewer than you might expect for somebody who has a full life. And hopefully we
Yeah.
all have full lives. But like pleasure is
Hmm.
not prioritized in our culture. And this is one of many ways in which we're told it's not important or that
Hmm.
it's indulgent or that
Yeah.
it's just not our birthright.
Right. That it's like it's somehow wrong if we want
Uh-huh.
to enjoy pleasure, right? Or
Yeah.
even with pleasure with food. And that's where like I said, I keep going back to like that is just I don't want to be there on my deathbed seeing all the ways that I restricted or controlled myself.
Yeah.
I mean, like for what purpose? Where did it
Hmm.
get you?
Yeah. Several years ago, I was watching an interview with someone, and the interviewer was like, "What's one of your guilty pleasures?" And the woman being interviewed was like, "Oh, I don't associate guilt with any of my pleasures." And
I
it like
love it.
blew my mind because I'd never thought of just the pairing of those two words and how awful that was. And
Yeah.
it's been kind of like a way that I think about pleasure from now on or from then
Hmm.
on of like how much fuller life is when there's no guilt associated with it. And why in the world would there be guilt associated with
Hmm.
pleasure? You're not hurting anybody, you know, like as long as you're not hurting anyone, I
Hmm.
should say.
Yeah,
Yeah.
good clarification. Right. But if we really explored that, we'd probably see it was rooted in things that maybe we don't actually value or believe in,
Yeah.
right? Sort of like that old sort of puritanical like control thing,
Hmm.
that probably most of us don't ascribe to anymore anyway, right?
Yeah.
But we just sort of hold that as part of our culture, right?
Hmm.
Even anti-fat bias being rooted in like racism and sexism and classism, that if most people actually explored, it's like, are those even values that I believe in?
Yeah.
Right. That, you know, part of like the whole change for white women was like during enslavement, not wanting to look like black enslaved individuals, right? Which was
Hmm.
a big push to like get smaller.
Hmm.
Um, and yet that's not even anything that is talked about. I mean, outside of,
Right.
I mean, fat activists, it's certainly talked about, but
Hmm.
I don't even think people know the roots of where all this stuff came from, which is really
Right.
ugly parts of our history.
Hmm. Yeah, what's the book? Is it Fear of the Black Body? Is that what it's
Yeah,
called?
by Sonia Renee Taylor.
Yeah,
And yeah,
so good.
yeah, yeah.
Um, Wonderful tangents. I love them all.
Yeah. I know, it's
Um,
like I get so like on my little pedestal with it.
Same. Um, I'm thinking about people who do not specialize in eating disorders and how these behaviors may present in clients.
Hmm.
They're not there for an eating disorder. They're there for probably anxiety, but anxiety, depression, I mean, a number of different things,
Yeah.
but
Hmm.
they're not presenting for eating disorder help. What are some of the patterns that people can be on the lookout for so that we're really clear, we don't make things worse as therapists?
Yeah, I think oftentimes what you'll start to hear is probably them discussing body image issues like being uncomfortable in their body, like we talked about earlier with diet culture, even desires to lose weight or wanting to lose weight. Those are things that ping for me pretty quickly, obviously,
Hmm.
as an eating disorder clinician. If you don't work with eating disorders, if you hear people start to kind of bring up some of those things or guilt around food, kind of going a bit deeper, tell me a bit more about that. What is your relationship like to food? Have you cut out any food recently? What are ways that you're trying to actively lose weight? Right? People might start talking about disordered exercise, hours at the gym. And again, recognizing that that is actually not normative, even though in our culture it is, right? That idea of this is probably wellness culture, diet culture makes those things normal, but identifying how often is your client exercising? What happens if they miss a workout? Do they work out when they're injured or when they're sick? Um, then starting to even go deeper, I think clients often will be finding other ways to purge calories that clinicians may not be aware of and that are often very shameful. So even my clients with eating disorders very rarely will outright tell me if they're purging through vomiting,
Hmm.
um, or using diuretics or laxatives. But
Hmm.
those are all, and exercise, exercise is sort of our culturally sanctioned way to purge calories.
Hmm.
But those are things to kind of start exploring and asking them a bit more about food. How often are they eating? Are they cutting out certain kinds of foods? And kind of going deeper in that to understand, really, is this actually a full-blown eating disorder? Are they on their way to an eating disorder? Because there's lots of disordered behavior in our society that is like normalized, that
Right,
might not even ping for a non-eating disorder clinician.
right. 'Cause I would say body image issues are probably normative in our culture,
Yeah,
but the behaviors that they associate with those issues might not
yeah,
be. Or maybe,
right.
but like there's a line of normative to disordered to like full-blown eating disorder. They're different, it's a
Hmm.
continuum.
Yeah.
Um, and I think too, like asking questions about like injectables and plastic surgery also,
Hmm.
because those injectables are getting more and more popular.
Yeah, like Ozempic, and is
Mhm.
that what you're referring to?
Yeah,
Yes.
yeah.
Yeah, right. Because some people will say, yeah, I've had clients that sometimes are seeing me not for eating disorders, and so they're sort of openly talking. And then I'm
Hmm.
like, wait, what? Like, oh, I've been losing weight taking these shots, or, and exploring that and talking through them. Or sometimes I have clients that will come to see me because they're wanting to get gastric bypass surgery and they need to have that signed off by a clinician. And so that provides me with an opportunity to explore, do they actually have an eating disorder? And I would say a lot of clients do, right? Which
Hmm.
is then even more dangerous to go get gastric bypass when you have an
Right.
active eating disorder. I
Hmm.
mean, the surgery itself is dangerous and I don't recommend it, but I also tell my clients I support body autonomy and I'm not going to tell them
Hmm.
what to do, but I am going to talk to
Yeah.
them about risks. And so I think for clinicians to kind of, when they talk about body image issues, that is an opportunity to ask a little bit more questions about, are they actively doing anything to try to change the shape of their body? And that's when you would want to get more information. I think even things like weighing themselves, right? Um, I think, again, that's something very normal that people think like you weigh yourself. If you talk to some clients, they're weighing themselves like 10 to 12 times a day, which is not normal. And I mean,
Right.
I don't think anyone should weigh themselves. However,
Hmm.
that's again one of those things in our culture that people think is just normal, to know your
Right.
weight, to weigh yourself on a regular basis, right? To keep you in line or keep you in check.
Right. Right. Yeah.
Hmm.
I think that this kind of speaks to like the difficulty between what's normal in our culture and what we know to be disordered, because there
Yeah.
is an overlap
Hmm.
that's pretty hefty. And I think that sometimes those can be bolstered by some of the myths around eating disorders. Like we can miss
Mm.
things as clinicians,
Yeah.
like the idea that people aren't really restricting unless they're at a scary low weight,
Yeah.
or that their health isn't at risk if they're
Hmm.
not at either a scary low weight or a scary high weight. Like these
Yeah.
kinds of myths. Can we
Yeah.
talk about some of the myths and the facts that can help guide clinicians in the right way?
Yeah, and that, I'm glad you brought that up because I think that's actually probably the biggest myth out there, right? That eating disorders have a look, right? You
Mm-hmm.
can tell if somebody has an eating disorder, and I think the statistics say what, like 6% of people with an eating disorder are underweight,
Mm-hmm.
right? So that means
Yeah.
the vast majority of our clients with eating disorders might be in a normal size or straight size body, or in a fat body, right?
Mm-hmm.
And again, that we assume that if that only underweight people can be at risk for death, when
Mm-hmm.
really eating disorders are the second leading cause of death of all mental health issues, right? I think
Mm-hmm.
not I shouldn't say finally because it's terrible, but opioid addiction surpassed eating disorders probably in the last five
Recently.
years.
Yeah.
Yeah,
Yeah. Because we
recently,
always said
right?
before it's the number one, and
Number
then
one.
opioid epidemic.
Yeah.
Yikes. Yeah.
Yeah, which is also terrible, right? But to say like this is the second most deadly mental health disorder, right? That they either die from complications of their eating disorder or suicide. And
Mm-hmm.
so these are the facts that all of us as clinicians need to know is that if a client is actively engaged in an eating disorder, their heart is at risk. If they are purging, right, potassium levels can get dangerously low and their heart can stop. Which is the part that scares me the most because I think that's another sort of myth out there that if they get labs drawn and they're fine, then they're fine. But really, with an eating disorder client, one day they can be fine and the next day they can be at major risk of death.
Right.
Um, and so, regardless of somebody's weight, they can be very sick
Mm-hmm.
on the inside, right?
Yeah.
Which I think the book Sick Enough did a really good job of talking through all of the medical complications that happen when you are restricting,
Mm-hmm.
right? Which is sort of another, even clinically speaking, in the DSM, I really hate that they have two diagnostic criteria for anorexia nervosa and atypical anorexia, which really the only
Mm-hmm.
difference for atypical is that you're not in an underweight body, which really even speaks to like our anti-fat bias in the DSM.
Right. Which,
Because
I
when
mean,
my
before the DSM-5, it like you couldn't be fat and have anorexia, So
right,
it's like
yeah,
there's some improvement, but like we got a while to go.
yeah, well, and they didn't even have binge eating disorder as like an official
Right.
diagnosis when that's
Mm-hmm.
actually again one of the facts is that's one of the most common eating
Mm-hmm.
disorders in our country, right? And so that really any body size can be very sick and at risk of dying,
Yeah.
because restriction is restriction, right? Oftentimes, most people's bodies will fight the restriction anyways. That's, I think, why probably only 6% of people might be underweight is that
Mm-hmm.
biologically speaking, not everybody's body will force you into that underweight part. It will try to
Right.
actually maintain weight to keep you alive.
Mm-hmm.
Um, And so I think those are kind of big myths out there that as all clinicians we need to be aware of,
Yeah.
right? That um, they don't have a look. They're also not just sort of the white rich girl
Mm-hmm.
diagnosis, right? That BIPOC community is actually probably underreported, doesn't actually get the kind of help or care that they typically need, right? So it's
Mm-hmm.
not that those rates don't exist amongst all races, ethnicities,
Mm-hmm.
and even that LGBT population is at higher risk of a development
Yeah.
of an eating disorder, that they actually have higher rates of eating disorders than their heterosexual peers.
Yeah.
These are all things that we need to be aware of.
Mm-hmm. Yeah. And I think if you're looking through the lens of the myths as if they were the truth, there are
Mm-hmm.
probably a lot of clients that you're not asking a lot of questions,
Yeah.
that could make a difference for their well-being and for their health.
Yeah. Yeah. Because I think they say about 9% of the population of the US population will have an eating disorder in their lifetime, right? So if we're
Mhm.
talking 9%, you've got clients in your office with an eating disorder. They
Yeah.
might not be endorsing it, right?
Hmm.
But they're there.
Yeah.
Yeah.
I'm thinking about the lab thing too, and
Mm,
how I know particularly in the olden days of eating disorder treatment when I was earlier on in my career, it was always such a frustrating part because often my clients would get written off by the doctors.
Mm,
They were like, nope,
yeah.
their labs are good. And so it made my clients feel like, well, what I'm doing is not so bad. And it would almost encourage it. Or the parents, if they were teenagers, would be like, she's fine. I mean, like, look, her labs are good. This isn't that
Hmm.
serious. I think we know a little bit more about eating disorders now, 20 years on. But I
Yeah.
do remember I was at a residential treatment program, and we were due to have a new patient come in who was my exact height and weight. And she died the day before she was going to come,
Oh.
not suicide, but like her body just gave out. And she was at what was deemed like a healthy weight for her size,
Hmm.
like
Hmm.
it's, it's not what we imagine. And, I'd been working there for a while, but I still, like, it was almost like it wasn't possible until I saw it, you know?
Yeah. Yeah. Hmm.
Um,
Well, and I mean, that's even where the insurance companies discriminate, right?
yes.
I have worked at higher level of care, and clients in straight size fat bodies usually got less time in treatment. They sometimes weren't even accepted into treatment because insurance companies didn't deem them as quote sick enough, right?
Mhm.
That there's even that bias with getting support and help, um, that that then leads them to be sicker for longer, right?
Mhm.
And again, I even remember too, even cardiologists, I think outpatient cardiologists have a much higher threshold, like, oh, their heart is fine. And I
Mhm.
remember an inpatient, like they didn't just look at, they looked at the QT, QTC intervals, and like their threshold for an eating disorder client heart is much different from a person in the normal population. So I think that's where
Mhm.
even those kind of things, like I've had clients in their cardiologists like, oh yeah, they're fine. But if I were to talk to an eating disorder clinic, like a medical doctor, they'd be like, this is not a good EKG, right?
Yeah.
Because they know the nuances that of what's happening when you're restricting, right?
Yeah.
And I think going back to facts, a recent fact that I read that actually surprised me because I think of the work that I do is they say only 8 out of 10 people won't even seek treatment for an eating disorder. So
Mhm.
if that means only two
Oh,
out of those 10 people are in my office, right? There's 8 more people out in the community that aren't. And so even for me, that as an eating disorder clinician, that was surprising that like how few people even actually seek out treatment. And then
mhm.
those that do, are they then still discriminated against because they're not underweight, right? Or their labs are fine.
Mhm. Yeah. And told essentially like you're fine, stop complaining,
Yeah,
by some of the people around them.
yeah, right. You don't look sick. I mean, that the amount of times my clients have been told they don't look sick
Oh yeah.
is so invalidating, right?
Hmm.
Because again, sick doesn't have a look, just like healthy doesn't have a look.
Right.
And so if we don't know what's happening internally in their bodies, even if their body is still functioning, because again, our body has like very adaptive functions to keep us alive, that doesn't mean that their brain is healthy, right?
Hmm.
That when they're so consumed with the obsessive thoughts about food and body, that is not somebody that probably feels healthy.
Right. Yeah. So the 9% of people with an eating disorder are seeking help. Like the 9% that will have an eating disorder during their lifetime, are those people who have sought help, or is that an
Yeah,
estimate?
or if they have actually just self-disclosed it, I don't know, right? The statistics say that 9% of people will have an eating disorder. So yeah, but whether or not that's people that have actually self-disclosed it or self-reported it or have actually sought help, because then that might
Mhm.
mean we're missing a
Yeah.
whole bunch of others,
Yeah.
right?
Yeah. And I mean, it makes sense. Like eating disorders work for what they're used for a time.
Yeah. Mm-hmm.
They work to numb, they work to bring attention to something that's less painful than maybe the
Mm-hmm.
things going on inside. They,
Right. Or to control,
or to
right?
control.
Things that
Yeah.
fell out of your control, right? Or even going back to diets, right? I think that's one of the strongest predictors for the development of an eating disorder is dieting,
Yeah.
right? And yet it's something that's so normalized and encouraged in our society.
Hmm.
Um, I think obviously the development of eating disorder is multifaceted. We've got to let go of sort of those old beliefs that it's only a result of trauma or a cold mother, right? But I think
Hmm.
we're starting to find that there is biological components as well as the like psychological and social components that develop an eating disorder.
Yeah. There's absolutely
Um,
heritability there,
yeah,
which is an interesting
yes,
thing. I read a statistic a few years ago about how eating disorder providers like therapists, dietitians, MDs are more likely to have kids with
Mm.
eating disorders. And I was like, damn it. But
I was like,
I
no,
can
don't
also,
tell me that. But
I know, I can
yeah,
also see though, so many of us are our niche, right? Like it's a
yeah,
younger version of us, or it's a thing that we've
hmm
been through. So I'm curious how much heritability has to do with that.
yeah.
Um, that we can't protect, like your daughter talking about her stomach. Like we
I
can't
know.
protect our kids. We could do everything right in the household, but we can't protect them from the culture that they're within.
hmm Yeah.
Um,
Right, because that's where eating disorders touch all forms, right? Obviously, if you grow up in a home that does talk more about body or restrict food, that's going to increase your risk. But
mhm,
then kids can grow up in homes where intuitive eating is the norm, right? And we accept all bodies and they can still develop that, right?
right.
And I think even if they've been doing some of the gene mapping and with anorexia, they're starting to to find, I think, that their hormone around sort of hunger is more muted, right? Which
Mhm.
is likely why individuals that are more restrictive, um, I don't like more able to do that, right? Without
Yeah,
the
yeah.
compensatory behaviors with the binging or the different things, if it's a pure restrictive type, right? That there's so much about that biology that we're still uncovering and unlearning,
Mhm.
right? But that we've got to look at the whole aspect, right? The facts are that eating disorders are multifaceted.
Mhm.
And as clinicians, we need to recognize that and actually explore all the different facets that might be the development of their eating disorder and not
Right,
just assume it's one thing or the other, right? It's not just because of social media. Certainly that plays a role.
right.
But that's not the only reason eating disorders existed long before social media and television.
Yeah. I love the
They
drive to
probably,
externalize it. Like it would be wonderful if
yeah,
it was something we could externalize, but
yes,
it's
that we
it's a
could fix.
contributing factor. Yeah, yeah.
Yeah,
It
right.
contributes for sure, but it's definitely not the etiology of an eating disorder.
Yeah. And I think that's one of the things as all clinicians we need to do is take a step back and say, what do we think were all the aspects that developed, this in your life so that we can
Mhm.
help them overcome it and not just assume it's one thing or the other, right? Those myths out there.
Yeah, absolutely. There was something else. Oh, you were talking about, I just want to say, like, kind of maybe end on one more diet thing of,
Yeah.
you were saying like 96% of people, quote unquote, fail at diets, meaning
hmm
the diets don't like, we're never like, I don't know, 96% of people failed at driving their car on this road, this one road. Like if 96 out of every 100 people crashed a car, we would think there was something wrong with the car. If that's how it happened, right?
Yeah,
We wouldn't
right.
blame the
Not the person.
drivers. Yeah. But there's also, is it still 25% of people who go on diets develop disordered eating or eating disorders? That like some high number.
It is a high number. And I wish I'd like actually logged that statistic. But the fact that
Yeah.
they say it's like one of the biggest risk factors, I don't know. I mean, just speaking myself, I think it's more than 25%.
Hmm.
Um, because I would say if all of my clients, they're at the heart of their eating disorders, restrictive patterns of behavior, right?
Hmm.
However, it comes out is different, whether or not they just purely restrict or whether then they go on to binge or purge it in different ways.
Right.
Um, but I would say almost all of my clients, if historically I asked them, it started with some form of restriction, right?
Hmm.
I cut out sugar or I cut out carbs or my health class talked about the dangers of this, so I stopped doing that, right? So
Yeah.
whether in their minds they thought it was a formal diet, there was some aspect of restriction
Right.
that developed it.
Right.
It didn't just like one day they woke up and they're like, hey, I'm going to eat my food this way.
Hmm. And thinking about like, okay, so there's a 4% chance of success, and then there's a 25% chance of getting the thing that has the second mortality rate in all of mental health.
Mm-hmm.
Like, let's all just stay away from them as best
Yeah.
we can. Let's not
Well, because,
promote them. Let's not encourage them. Let's not talk about like the one
yeah.
we're on. Let's do what we can. If you're listening and you're on a diet right now, to like ease your way
Mm-hmm.
back into listening to your body because it will tell you, I promise. I know it's
Yeah.
scary to learn to trust your body again, but
Mm-hmm.
it will tell you what you're
Yeah.
hungry for, when you're hungry, when you're satisfied, if you remember to check in and listen. And it gets more intuitive the more you do it, it gets
Mm-hmm.
easier.
Yeah. Yeah. I mean, because, I mean, don't you really think if you actually broke down what somebody's doing in a diet and then cross reference the DSM, that would be an eating disorder? right? Whether or
Yeah.
not it's for 3 months or a
Mhm.
year, right? Even in the OSFED category, like bulimia, binge eating, and anorexia can all be sort of for short periods of time, right? That's why it
Mhm.
hasn't hit the full diagnostic criteria,
Right.
right? But really, if you broke down somebody's diet, it's all eating disorder,
Hmm. Yeah.
according
Yeah.
to the DSM.
Right.
So is it really a diet, or are we just encouraging low level eating disorders and then the pendulum like shifts and they maybe go back to normal eating, but they're still feel that pull around the food or the,
Right.
the shame around that.
Hmm. Yeah. The guilt is, it's really intense guilt people feel when they feel like they're eating something they should not be eating. That's
Yeah.
a, that's like when you take it out of the context of our culture. And I
Mm-hmm.
say eating something you shouldn't be eating, you think about like something disgusting or something with mold on it or some poop or I don't know. But like
Yeah.
it's the same level of intense shame that be like
Yeah.
eating an ice cream, which could be really pleasurable.
Mm-hmm.
And it takes away from their life to feel so bad about it. And it's all
Yeah.
consuming for so many of our clients too.
Yeah. Or that they ate a full sandwich at lunch,
Oh,
right?
yeah.
And they feel guilty about that because I had too much carbs or I
Mhm.
shouldn't have eaten the whole thing, right? That if you really start talking to clients when they start normalizing their eating patterns, even how off their perception is about normal portion sizes
Mhm.
because the diet has been so restrictive, right?
Yeah.
And I mean in our society now they just like to call it like wellness, which is,
Right. Yeah,
so
sure.
I sure. So I think my bias is that all diets to me are just actually eating disorders in disguises. I know that people aren't thinking that's what it is, but really, I have yet to see a diet that actually is normal eating
Mhm.
patterns, right? Variety of food. They're never that.
Right. Right. Thank you for talking with me about this, Ashlyn.
Well, you're welcome.
I hope that therapists feel more prepared in what to look for in session and that they're also challenging some of their own um, biases or ways of managing food and body themselves
Mm-hmm.
based on the
Yeah,
conversation.
I hope so too. I think that's the best we can all do is just try to unpack that a little bit more and
Yeah,
recognize that we're all part of the culture that we live in. And can we start exploring how that might actually be unhealthy for us or maladaptive for us?
absolutely.
Yeah.
Awesome. Thank you so much.
Okay. Thanks for having me.
Sure. I hope that broadened your clinical horizons. Head over to notboringces.com to get your CE credit. Want to have a not boring conversation with me about your clinical area of expertise? You can apply there too. If you like this conversation, leave us a 5-star review, tell a friend, and be sure to subscribe for future conversations.